Manager with the Department of Health. Micah is the Substance Abuse and Tobacco Prevention Program Manager. Micah studied at Iowa State University, where she received her bachelor's in Child, Adult, and Family Services. She started her career in education before transitioning to prevention in 2018. She was a prevention specialist in Iowa before moving west to start her role as the Tobacco Prevention and Control Specialist at the Department of Health in 2020. Implementing evidence-based strategies and cross-functional collaboration continue to be a focus of Micah's work as she is transitioning to her new role as a program manager. In her free time, Micah enjoys volunteering in her community, spending as much time outdoors as possible. Skiing, hiking, kayaking, camping are a few of her favorite activities. Let's welcome Micah.
Can you hear me okay? Okay, perfect. Thanks for the introduction. So I'm Micah Muller, and as of February 1st, I took a new role with the department as the Substance Abuse and Tobacco Prevention Program Manager. So a mouthful, and a new start kind of for our unit too, because we are combining our substance abuse and tobacco prevention programs together into one. So it's a good learning experience the past month. And I made a joke earlier that I'm hopeful month 2 is a little easier than month 1 was, because it's been a transition. And I did start in Iowa. So I grew up in Iowa in a rural farming community, and stayed in Iowa up until 2020 before accepting the job at WDH as the Tobacco Prevention Control Specialist. I would say, I was making a joke to James earlier that I had thought it would be an easy transition. Iowa tobacco prevention should be like Wyoming tobacco prevention. It was not. It was not what I thought it was going to be. I have very few years of memories where we were picking smoke-free sections of a restaurant. And that's a reality in some communities still here. So I was not used to that. I also, in my head, made this joke, so I'm just going to say it out loud. But when Dr. Grand Prix was saying he started in 2002, I was thinking, yeah, I was learning how to read in 2002. So I'm definitely humble enough to know I'm not the expert in the room, and I just know a small portion of this field, and I'm still learning. So hopefully I can teach you something, or you can get something out of this presentation, though, anyway. Since I know there's some data people in here, I will start with some data points before I go into my presentation. So from our adult tobacco survey, it was our most recent one was 2019. 2 out of 5 current smokers have attempted to quit in the past year. And then 88% of adult daily smokers started before the age of 20. I'm sure that's not a surprise to many. 50% before the age of 18. And since this survey was 2019, I should note that Tobacco 21 came into effect in 2020. So we'll see if there was a change when we see what 2021 looked like. And then let's see. So a big topic in the last several years have been vaping, or ENDS, so the electronic nicotine delivery systems. And with adults, there have been 3 identified disparity populations that are using disproportionately to the majority, and those are American Indian, and about 15% of those now let me think how to say this. 15% of those who were surveyed that were smokers identified as AI. 12% were between the ages of 18 and 29, so young adult, and 12% were identified as having a behavioral health condition. So those are 3 populations that have been a focus of our program, continue to be a focus of our program. And with our work plan with the CDC, those are the 3 that we have identified for the next year to continue to focus on. And then to transition to youth, because I know that's where we need to start. It's easier to prevent it than it is to get people to stop using tobacco. I'm sure if you've seen anyone in your life go through that, you can definitely agree with that statement. And so it's good to know where the youth are at these days. So our youth P&A data, which is the prevention needs assessment that comes out every 2 years. Cigarette use in the past 30 days in 2020 was, I like to think of the positive. So 95.95% of our 6th to 12th graders had not used a cigarette in the past 30 days. And in 2018, it was 83.37%. So that's a huge jump in 2 years. But with P&A data, since it did come out, or the survey was done in 2020, it was done in spring of 2020. So you can imagine there were schools shutting down. We did not see the same amount of surveys. So we always have an asterisk with that data from 2020, and it'll be better use seeing what 2022 looks like. But with vaping 30-day use in 2020, there were 81% of our 6 through 12 had not used in the past 30 days. So that is about 20% had. And then 2018, it was about 76.94%. And so again, it is moving in a positive direction that there are less of our youth using vape or cigarette use. And I just noticed I did make a mistake in the cigarette 30-day use. It was 2001. It was at 83.37. So that was our first P&A data. And then our perception of harm with cigarettes. So in 2020, youth said 62% of youth said that they thought cigarettes caused great risk, which take it how you think if that's good or bad. But I will say in 2001, it was 64% had identified at great risk. And so the perception of harm around cigarettes is actually going down with our youth. And then we only have 2020 data for vaping perception of harm, which sat at about, no, I'm sorry. I will go to my slides though. No, I know. I thought, yes, no, you're not missing graphs, just listening to me. So we had only 42% of youth identify as great risk for vaping. So obviously that's a target. And then I'm someone that likes repetition in my data. So I did write down a couple of the data points that Dr. Grand-Prix said, because just in case anyone missed it, in 2019, there were 225 fatalities from lung cancer and a 24.4% survival rate at 60 months. So that is our tie into, let's talk about tobacco now. So those are the data points I had. I did want to talk about what we've been doing in the past year. Since I've been with the program a year and a half now, I'm still definitely learning Wyoming, learning the needs of Wyoming, since I did identify some differences from where I was coming from. So always open to being engaged and finding partners in the field. So before I move on, I'll pose a question that you can think about. And if you have any responses at the end, I will gladly take them. Just wondering how we, as a tobacco program, can be better partnered with cancer prevention. I think we're moving in a good direction. I think we've been more involved in the past year than maybe in previous years. But if you think of any ways that we can be working on the local or state level to be better partners, I'd love to hear it. Great. Okay, so just because this is brand new, I don't know how many are familiar with our department or our division, specifically our unit, but it has changed a lot in the past couple of months. So previously we were separated: tobacco prevention control and substance abuse prevention. So we are under one unit. So I did want to touch on that our capacity is a bit smaller than it was. We did lose one program manager. So as I'm transitioning, also bear with me as I learn this role and learn how to do both. But so this is kind of our setup right now. And then I think one of the biggest and best parts of my job and of our unit is our CPG grant, so our community prevention grant. All of these funds go directly into our communities, and every county has the opportunity to apply for this grant. It's not competitive, so it can go directly for them if they opt in. And we had 22 out of 23 counties do. And we are finishing up our year 2, so we're about to start a new grant cycle here in July. But I did want to highlight some of the work our communities were doing in tobacco prevention control. So these are the top 5 strategies that were in our county's work plans. So the first one being 20 counties opted into doing Wyoming Quit Tobacco. So Wyoming Quit Tobacco is our quit line. National Jewish Health is our vendor for that. So our counties either purchase brochures, quit kits for providers, or boosted digital ads for us in the past 2 years. Let's see if my link works. Yes, we have me quick.
Is this the screen you wanted to open?
Yes.
Okay, so we just.
Okay.
Oh, wait, hang on. Not that far. There you
Okay.
go. So do I need to click on any of those? Or?
I think I can, I think I'll break my neck. Just kidding. Okay. So I just wanted to show you an example. So we can go to this handout. This is a handout that is given by our CPSs to providers as they talk to them about boosting referrals, updating their policies, and just gives you an idea of the different materials we have available. So this was updated in 2020. We had a brand, an entire brand revamp. So even our logo is different. But they're able to talk to them about how the program works, different assets that come with the program. So I would say one of the biggest that we always push is the free NRT. Wyoming, we call it the Cadillac version of a quit line because we offer 12 weeks of free NRT, and that's patches, gum, lozenges, Chantix, but we're under a recall right now, and Wellbutrin. And so that is very expansive compared to the rest of the nation. So that's a big push that we do. It's 24 hours, 7 days a week, personalized. And yeah, so we have a bunch of different materials that we just created here in the last couple of years. And so it's been, that's been a big push for our counties this grant cycle. Going along with that, for our youth, 18 of our counties did My Life, My Quit, which is our youth quit line. It's a texting, you can text into it, which is easier for our youth to do. The biggest difference between Wyoming Quit Tobacco and My Life, My Quit is we do not provide NRT through them because under the age of 18, you need a prescription for that. And so that's the biggest difference between the two. There are still digital ads associated, and they promote our materials or My Life, My Quit materials across the state too. This has also been, I know it's cut off a little bit, but a big topic in recent months has been doing alternatives to punishment. So much research has come out that punitive measures don't necessarily work as well as alternatives to punishment. So a lot of our counties have been adding My Life, My Quit or other cessation options into school policies for when youth are caught vaping or with other tobacco products. And then the next one, a lot of education. That has been a big push in the past couple of years. So 14 of our counties did parent and or youth education in the county. So a lot of that was surrounding vape because that's a hot topic. We are seeing, I will say in the future, we are seeing a push to do more parent vape education and also starting youth much younger with education. I would say a lot of it was high school this go around, but initiation is starting in middle school. So focusing on middle school or even upper elementary grades is probably the move in the next couple of years. And they do this at different presentations, different booths that are high trafficked areas, sporting events, all sorts of areas. And then, so those are cessation, and now we're moving more into the education, but we also do a lot of universal strategies, and one of the biggest one is the smoke-free policies. And like I spoke earlier, this one, when I had been working on the ground level at the local level in Iowa, our focus was transitioning smoke-free policies into nicotine-free policies. So some of the nice part about if there are bars, restaurants, parks, et cetera, that aren't smoke-free, it's nice that we can just make them nicotine-free and not have to go back and change them. So that's been a big transition, is updating signs to also feature nicotine products and update those policies. So 10 of our counties were working on that in the past couple of years. And then 8 of them were doing group cessation. And this strategy list came from when our grant had just started. So this number is definitely higher. I would say we're closer to 15 counties doing group cessation. And so it started, a lot of them were doing adult voluntary groups, which was great. And it was during the pandemic. So figuring out how to run those groups efficiently, whether that was virtual, a hybrid option, or staying in person if groups were small enough. But we have seen a transition in the past several months that they're identifying a gap that inpatient and outpatient settings have not had tobacco cessation, and specifically substance abuse treatment centers aren't doing tobacco cessation like they're doing when they're going through treatment, which we know best practice is that you become sober of all substances. So doing cessation along with treatment is what is best practice. And so they've identified that group as needing group cessation. And so a lot more groups have popped up in those areas. And then youth, that was a plan of many of our counties. And with COVID, they weren't able to get into schools how they pictured they would. So a lot of them are still in the planning phase for next year and being able to run those groups next year. All right. And then our state priorities, like I said earlier, our 3 priorities are behavioral health, American Indian, and young adults and youth. In the past year under behavioral health, my old supervisor, Hannah Johnson, and I both went through a community of practice, a 6-month community of practice with other states to learn how to work with behavioral health and promote cessation and prevention into facilities. And from that, we created a pilot program. We identified 2 behavioral health facilities to work with, to work in their policy. So let's take a look at your policy. How are you doing cessation? How are you doing ask, advise, connect? And then provide them materials, education opportunities for their staff. We had a really great plan. We still have it, I should say, but Hannah Johnson also left shortly after that. So it was kind of a one-woman team for the past several months. So it's my dream one, which will be a reality once we're fully staffed, I know, but so that plan is still relevant, and we're waiting until we have the capacity to do that. So as you see, it's my future plan. It's number 1 on my future plan. And we also I might come back to these resources if I have time, but we also did a provider toolkit with National Jewish Health, our Quitline vendor. So they lay out how to implement Ask, Advise, Connect into their practices, how to utilize support staff to help, and then also pushing our e-referral system, which is a one-click system to make it easier to do those referrals. Also in the Quitline, we starting July 1st, we had Quitline Behavioral Health 2.0 protocol. So Wyoming was one of a few states that was in the pilot program for the Quitline, and we have now expanded that. So if callers identify as having a behavioral health condition, they can opt into this protocol, and it extends the number of coaching calls they have. Those coaches also go through training to help with system management and additional triggers. And so we're really excited that we'll see some data on that hopefully soon. Our year mark will be in July. So our future plans for national or for behavioral health also is NRT, expanding NRT. Right now, like I said, we have a really great NRT in the quit line, 12 weeks free, but those that are in inpatient settings aren't able to communicate with the quit line because they don't have their phones or internet access. And so without that, that's a huge gap that we've identified. So we are working with National Jewish to have bulk NRT mailed to facilities that inpatient facilities that would like to do cessation and provide NRT for free. So that is a plan for the future, the next grant cycle. And then our unit is also in the process of doing our 5-year strategic plan. Tomorrow is the meeting number 2, so very early into it, but we're excited for that. And then our American Indian population, we work under the CDC grant, tobacco grant, and we're about to start year 3 in April. And American Indian is our community health disparity population. So it's a requirement under CDC. So we have been contracting with the reservation for years. And along with the cancer program, we're partnering with them and we're expanding that starting in July. So we will be funding both tribes to do tobacco and cancer prevention work. So that's something we're very excited for. I know STARS program is very excited for it too. And then young adult and youth. So education, as I said earlier, had been one of the biggest pushes in the past 2 years. And then with the Wyoming Cancer Coalition Prevention Work Group, this year we are still working on a school nicotine-free toolkit and model policy. So that will be available to all schools. Will disseminate that to all of our community prevention specialists. And that can be a strategy that they work on in the next grant cycle is reaching out to those school districts to make sure they're comprehensive and featuring alternatives to punishment within their school policy. And yeah. Oh, we have a new media campaign coming in 2023. So we're just in the research stages of that state media campaign. Okay, just checking on time. Okay. And so our partnership so far, or 3 areas that I would see as a benefit. First, to promote referrals and cessation. That's going to be one of our biggest pushes in the next year because our referral rate and intake rate at the quit line has been declining for the past 6 years. And so I for sure would like to see our referrals boosted. So I did post a link to both our quit line and My Life, My Quit Wyoming links, which I can show at the end. And then, so promoting that through print or digital ads starting today, March 1st. Starting today, our next Wyoming Quit Tobacco campaign is on their Heavy Up. So that will be on a lot of print media, a lot of paid search for the next 3 months. And then it'll go into normal paid search. We have it year long, but starting today until the end of May, it'll be in the Heavy Up version. And then if any of you know of any providers that are interested in our e-referral system or updating the referral process to make it easier, we have a lot of funds in National Jewish Health that we can help kickstart that for free and help support that system. So reach out to me if you know of anyone, or and I can help get that process started. And then our youth e-cigarette prevention. I know that's one of your goals under the prevention work group. And so I've been involved since August now with them. And so that's, like I said, we were working on that toolkit and model policy for the past several months and finalizing that up. So if there's any other educational opportunities that you'd like vaping presentations, across the state, there is a at least one community prevention specialist in every county except Platte. And so there is someone out there that can provide that education. So if you go back to your communities and identify a need, always reach out to me and I can get you in contact with who that person is in your community. I also, going back into your communities, if you want to be a part of tobacco prevention and control at the local level, there's also a coalition in every county but one, because that is one of their requirements with the CPG grant. And a lot of them have tobacco prevention control task forces within their coalition. And so if you're interested in being connected with a local level coalition, reach out to me also. And I know this was said, but cross-functional collaboration is huge for me because we're such low capacity. I know we have to lean on each other. And so any partnership and any way I can help, I definitely will try because I know I'm going to need some help down the line too. So right now with the cancer program, we have that Wind River Reservation to 2 of those contracts going in July. We also have been working with James on the referral system for the Wyoming Cancer Program in the past several months. And then, like I said, I'm open to any additional partnerships with you guys that you can identify or any gaps that you see that tobacco prevention control can help fill. I'll take questions, and then if I have time, I'll show you some of the resources. If anyone has any questions.
Thank you so much. Again, such important work. And two things really jumped out in my mind as you were talking. One, it's easier to never start than to start and quit. The second is that 88%, I think you said, started before age 20, which made me think of the school system. And then I was happy to see that in your slides, there was some partnerships with schools. It also made me wonder, though, if there is a dialogue on the highest levels, that is like with the head of the Department of Health and the head of the State Board of Education, or the Department of Health and local school boards, to get some of the prevention programs in place. And you've just started, so I don't know if you can comment as to whether those dialogues are happening, but it seems as if they should, and that may be something which we as an organization should think about facilitating.
I would say not enough if they are going on, so I agree. Is there any other questions or comments or ideas for me? Well, I just wanted to show you kind of what it looks like in case you haven't seen our website. I figured, oh, there we go. Okay, so this is our Quit While website. So like I said, we just revamped the entire branding. So the website was revamped too. It's really easy. Right there, enroll online or click to call, and down below it says what our offerings are through the Quit line. And I do want to show you what it looks like when someone goes to enroll online. So on this page, I think this is our Quit Logics page. So this is through National Jewish Health, what they built for us. And right at the top, it gives some information right there, enroll now again. But one newer piece of this in the past 2 years that I did want to point out is this section, the health professional section. It goes in and talks about what AAC is. So Ask, Advise, Connect. It has some education. Look at me breaking my neck over here. No, but a really great place for providers or staff to go to. Does this say the refer? Is it up right here? Okay, thank you. So in this place, you can do an online referral right on the website. There also is, you can do, if you prefer fax referral, it's right there. It'll pop right up. There it is. And if you want to learn more about the e-referral system that I was talking about earlier, it's right here with the opportunity to connect right to National Jewish Health, who can help set that up in the contact us section. So I did want to show that. And then Also, My Life, My Quit, just to show you what that looks like for youth. So right there is the Start My Quit, or you can do a live chat or a text option. And then there are free resources that you can print and disseminate how you want in this free promotional materials section. Now let's see. Okay. I think that's all I have for you, unless anyone has any other questions. All right.